there's just so many, I want to, take a stab at the employers, but I also want to sit on their side too,
Yeah.
because, we work in such a complex industry and it's so easy just to, accept it is what it is. Hopefully my insurance carriers, doing right by, what we're trying to do here. And we're sending them a ton of money every year for our insurance premiums. But I think there's enough employers that are, starting to ask more questions and say, enough is enough, because it's just become this huge expense. And why I wrote that article too is because I think most employees have been conditioned, just probably friends and family, to say like, oh, well, you can't retire early because, health insurance, it's so expensive,
Hmm.
which it is. And, I would argue that the individual marketplace is even worse because that's just riddled with all the big insurance carrier type plans. Um, and so if you're trying to retire before you turn 65, it's just really not feasible. And so, the employer health plan coverage is really holding the employees hostage because they're going to stay on your plan until they, turn 60, 63 and a half,
Yeah.
until they can, elect Cobra and
Right.
yeah, and then go on to Medicare. And we see that time and time again, where people are just staying in the workplace longer because they can't afford to retire early and buy their own health insurance coverage. But at the same time, it's like these employers are not, digging into the weeds enough to really get their costs under control. So they're significantly overpaying as an organization. Therefore, their employees are also significantly overpaying, as far as payroll deductions go.
Yeah. Yeah, but and just again, the article overall, it makes sense, but it's something that, like, I mean, I personally never really thought about that. Like, well, I'm just staying here because the insurance coverage. Um, that's, that is tough to swallow,
Yeah.
especially as an employer. It's like, oh man. So hopefully it's getting people thinking. I think that was one of the intents of your articles, was
Yeah.
not not to slam on employers, but to get them thinking. What really is that water cooler conversation, that the employees don't want to hear them talking about. And so just
Well, I think
just the
even
feed.
from, the HR's perspective, most of them are used to sending that annual email that, hey, it's time for open enrollment. Sorry, we had to, raise deductibles, or hey, we're going to take an extra 20 bucks out of your paycheck. And, we're really trying to, educate as many employers as possible. And, I love platforms like this. So thanks again for allowing me to join you, just to educate employers that there is a better way.
Yeah,
And
yeah.
there is a way to build a health plan that you can be proud of. And, that actually reduces the financial burdens to your employees. So, I mean, what's the biggest stressor in the workplace? It's usually financial. Well, what ties into the financial piece? Healthcare and
Sure. Yeah.
insurance. And,
Yeah.
can't afford to have it, can't afford not to have it, can't afford to use it, can't afford not to use it. It's,
Hmm.
what is it?
Yeah.
The number
Yeah.
one reason that people file for bankruptcies due to, healthcare related reasons, and two-thirds
Right.
of them had health insurance. So now you're just offering your employees a benefit that doesn't even really offer them much protection. So there's a way that we can flip the script and actually build a plan that you can be proud of, remove those financial barriers, actually improve health, which is going to improve productivity and engagement in the workplace. They're going to be better employees,
Hmm.
better fathers, wives, aunts, uncles, whatever, because our health is everything.
Yeah.